Hey girl, hey, this is Dr. Tasha and I am back. If you are new to my channel, welcome girl. We got all the vibes with all the medical information served in a very comfortable and sometimes funny way. Okay? And if you are familiar here, you are a follower. What's up, girl? If you are not subscribed, what you waiting for? Subscribe and like and share so I can keep bringing y'all these videos, keep bringing y'all this heat. And if you are not a member, I don't know what you're waiting for. I don't know what you're waiting for. We got prizes. We got secret info. We got secret lives. We're answering questions. We going in with our members. We're not playing over here. We're not stealing your money and not giving you the good stuff. Okay. So anyways, the last video I did, I talked about vaginal hygiene, how to clean your cooch parts, how to clean your vagina. Okay. I got so many comments and so many requests, little secret requests too, but I got requests on how to clean the vagina different per age group, like different things that you may run into, different products or whatever the case may be. So honey, let's get into it. Let's start with the little itty bitty kids first and foremost. One thing as far as differentiating from baby to, I guess, toddler, we're going to separate at age 3. Now, you don't need to give your baby, like your 1-year-old, a bath every single night. Now, I probably would, but you don't necessarily need to do that. You can sponge them down 1 or 2 nights, or if you're going to sponge them down in the morning, give them a bath in the evening, whatever the case may be. But just please make sure you are very, very cognizant of washing off the soap. Okay, make sure you got all the soap. You know, sometimes people get lazy and it'll have bubbles, and now you keep going to the water and wrenching it out, keep going to the water, wrenching it, and girl, the bubbles won't go nowhere. You just grab the towel and get the wiping with the towel. No, please have like a whole separate basin just for water. Make sure you're getting the soap off of little mama's vagina, like not vagina, vulva. The outside, for this, we're going to call the outside, the vulva, the labia, all that. When we're talking vagina, we're talking inside, and we're not going to bother that. We're not going to touch that. That is the part that's self-cleansing inside the hole, okay? Not outside. The outside part, we're going to clean that. We're going to clean that, girls. I don't know what people been telling y'all, but we're going to clean that, okay? Period. All right. So, you know, people always ask me, you know, because y'all know the rules. Never shampoo your hair in the shower. Never use liquid soap of any kind. I don't care who made it. I don't care. And people are like, well, can I use Dove? No, not Dove either. Now, y'all know I recommend Dove bar soap if you can't get the Clean and Cute body wash bar, which you can find at cleanandcute.shop. Go to the shop tab and boom, it'll be right there, okay? Point blank, period. But if you can't get that, you don't have access to that, you can't afford that, you are in Australia over there, because we see y'all over in the Himalayas, like, y'all be watching too. I see y'all. Love y'alls. But anyway, if you don't have access, then Dove white bar soap. People say, well, why can't I use liquid soap? Why can't I use the liquid soap? What's the problem? And it is because when you have liquid soap, shampoos, liquid soap, anything, they contain something called lauryl sulfate, sodium lauryl sulfate, or SLS. They contain a bunch more, but those things are seen as irritants by the vagina. Okay, the vagina does not like it, girl. The vagina does not like the sodium lauryl sulfate or any of the above. It becomes irritated, and outside of that, it can cause irritation. It can cause infection. We'll talk about how, and it can also cause vaginal dryness. So sometimes you're like, "Ooh, my coochie it's just so dry. It's just so, I don't know why it's so dry, honey." It is that you going all like that with the loofah with that. And don't get me started on the loofah. We're going to talk about them dang on doo-doo turd containing loofahs. I can't stand me a good loofah, because girl, why? You know, when you go and you wipe your booty, first of all, you ain't gonna wipe as hard as you need to wipe because they're abrasive. So you ain't really even getting all in there. So my BBL girls, with all the troubles that might be part of the problem, you ain't even getting all in there, and then you wiping and wipe. Girl, if it ain't regular, I can see you doo-doo on there. It's microscopic doo-doo. I don't like it. I don't like it at all. Miss me with a loofah. Anyway, But as far as the liquid detergents, they have harsh chemicals in them that really affect the vagina. And also, even with laundry detergent, some of that residue is left in your underwear, and it can cause irritation of the skin of the vulva. Like, so it's for real. Like, it's not just, I'm just not saying it. Also, a lot of these harsh chemicals that are in the body washes disrupt the pH in the vagina. So the vagina has an acidic pH, meaning the pH number is really, really low. But these detergents have an alkaline pH, which means the pH is really, really high. And what that does is, it causes infection because it disrupts your pH. It kills off all the good stuff. So, we know the lactobacilli, for the most part, is the good stuff. But when you have the harsh chemicals in the alkaline pHs, that's what's setting your pH off. So all these little claims, the feminine products, the feminine washes, they're all like, we fix your pH. No, you don't. No, you don't. You perfume away the odor for 24 hours. And that's why people be like, oh, I smell like fish if I don't use my feminine wash. No, you smell like fish because of your feminine wash. Let me just get you together. You just getting 24 hours of relief every time you shower, and I hope that's within 24 hours, but let's not go there. We're talking about the kids right now, because this first series, this video, we're going to talk about the kiddies. Okay, so now, like I said, as far as under 3, baby, you just got to wash them up good. Make sure you're getting all the stuff with them still wiped from front to back, wash from front to back, and make sure you're using mild soaps. Even because it's a liquid does not mean it is gentle. Mild soaps, because kids get a thing. Adults get it too, but kids really get it. And we're going to talk about it in a minute when we finish running down. But as far as like, even like some of the fragrances are so harsh. They're not like natural oils or more harmless, which is why people are like, well, you say use Dove white bar soap, that got a fragrance too. First of all, calm down, like relax, don't be attacking me because I'm from West Philly. Don't do that. Next, the fragrance is not like a harsh sodium lauryl sulfate type of chemical type that's going to be in your Dove white bar soap. It's a total different thing. Now, oftentimes too, because of these, and here is the reason with the liquid soaps, especially in younger girls, you have to be very, very careful. And when I say younger girls, it's because sometimes some things are acceptable in young ladies who have not had a period yet, which means their labia is not estrogenized yet. So there are some things that are a little bit more acceptable. So it's not to say that you can't ever do bubble bath, but it has to be very sparingly. And then let me tell you how you can do it and how you're supposed to do it and how you're supposed to clean little mama. Okay, so outside of that, if you're not getting all the soap is too harsh, it is too perfumey, it can cause a severe irritation in a little girl called soap vulvitis. I'm not lying, it's a thing. It is a thing, soap vulvitis. That's what she's called. And what are the signs of soap vulvitis? Now, it's not limited to, but it can be itching and burning and swelling and redness of the labia and the vulva. And mama she will just be having a little fit. And you be like, who touched you? Who did something to you? What is going on? I'm going to have to kill everybody up in here. Okay? Male and female, because they be getting tricky these days. But no, it is soap vulvitis. And so it is just, the soap is just too harsh, and we're not rinsing it off the way that it needs to be rinsed and clean, because you leave your 3 or 4 or 5-year-old to their own devices in the tub or the shower or the tub, and you can't do that. So if we're gonna do a bubble bath, very sparingly, and we're gonna make sure we're not gonna use harsh soaps at all. Nothing with dye, nothing with color, nothing with a bunch of fragrances, nothing liquid. And then when little mama is done in the bathtub and she done had her fun and she done all the things, you, mom, are going to make sure that all the soap, or dad, because at the end of the day, we got girl dads out there, okay? And this is for y'all too, because y'all don't know. but this is for y'all especially, but make sure it's all rinsed off and cleaned off, and you might want to make them stand up and do a shower. Or if you have a handheld, do a handheld and make sure you are rinsing little mama all off in her booty, on the vagina, the vulva, the labia. Make sure there's no residual soap, nothing that's going to linger and irritate and bother her, okay? Then when we get out, obviously, you know, we talked about residue of chemicals being on the panties, and which is actually the reason I created, the panty wash is because we learned that the chemicals in and the detergents actually are not cleaning the bacteria. It's kind of just washing it around. It's not really cleaning it out, and that's why I created what I created. But at the end of the day, we want to make sure we're drying them off with clean, dry towels. Also, if you're going to do an evening routine like your oils and things like that, please don't touch the vagina with any of the oils, any of the lotions, or any of the above. No perfume or nothing like that. It is always beneficial for a little girl to sleep in a nightgown over a onesie or pajama pants. Her vagina needs to breathe overnight. And also, what was I about to say? Damn, this brain fog. So it's no panties either. So she shouldn't be sleeping in panties, and it should be a nightgown, not a onesie. I mean, you can't help it, you can't help it. If you gotta have in some pants or some shorts, you gotta have in some pants or some shorts. But it is probably gonna be more advantageous. Obviously, we wanna make sure everybody is safe, but to be in a nightgown, no panties. Got it? Kind of just like you, Mom. But in a nightgown, no panties, and then we're in good shape. Does that sound good? Always be very cognizant with skincare routines, because if kids have conditions like eczema and things like that, we know you want to get all of it. We just want to get it all. And, you know, but yes, you can, you know, put, you know, lotions or whatever type of medications they have on their butt, not inside the booty, but on their butt cheeks, their back, their whole body, but not the vulva, not the labia. Now, if your kid is somebody who has gotten soap vulvitis, you like, oh, that's what that was, or you happen to see it after this video, because you know how things go. You ain't know nothing about it. You saw the video, boom. Little mama has, what want to do is make sure all the soap is rinsed off well. A cool compress, don't go out get nothing fancy. A cool compress is nothing more than a washcloth with cold water on it, and you just sit that on the vagina. Actually, you can even get a hair dryer, but not with the hot air, y'all, with the cool air, and blow cool air down there on little mama. In a situation like this, you may have to just calm things down. You may have to use like a hydrocortisone. Don't go inside the vagina. Stay on the outside of the lips, and that might kind of just cool things down and help her out a little bit. But if you've done all these things and she still is getting the business, because again, with these bubble baths and everything and all this fancy chemical-based stuff, it is very easy for little girls to get urinary tract infections too. So if she's burning, she doesn't want to pee because she's burning when it urinates, you're seeing little spots of blood or little specks of blood, that's probably an indication that she may have a UTI as well. That is when it is time to see the gynecologist. I'm sorry, the pediatrician. I'm forgetting what we're talking about. The pediatrician, okay? So I hope that guy gave you guys instructions on, from babies, like I said, you just have to make sure all that soap is really, really rinsed off of them. Like literally after you're washing with soap, you wanna do a whole round of the same washing with like plain water, okay? Just be very careful of the baby wipes too. Your baby wipes, that's cute. We gotta wipe with the poop and all that kind of stuff, but just make sure you're not just baby wiping them to death and leaving that on the skin, because it itches. It causes burns, and just, it's uncomfortable for them. So don't do that. And then again, we can't really start bubble baths until the age of 3. And my recommendation as a gynecologist is to stop it once little mama has started her menstrual cycle. No bubble baths, and not even for anybody over that. Like no bubble baths. Like no, we're gonna stop them from 3 until whatever time they have a period. And then we're not gonna do them every night. And then we're gonna stand up and we're gonna rinse off like a shower afterwards to make sure all the soap is gone. And Mom, I need you inspecting the cracks and crevices and get in there with the little handheld. Okay, got it? Mild soap, not the liquidy stuff. I'm sorry. No Mr. Bubble. It was Mr. Bubble when I was young. I'm showing my age. But no Mr. Bubble, no none of the fancy stuff, nothing that your 15 or 16-year-old done brought her from Bath and Body Works, and no. No, not for the kids. Now, you want to use it as an adult and get vaginitis, that's on you. I'm at the office, I'll treat you. But at the end of the day, not for the children, okay? Not for these kids, okay? Not for nieces. Do not put that on niece, okay? All right, so now, since we've gotten the kids out of the way, please drop any comments as far as, were you guys doing anything that I said not to do? Did you know about the soap vulvitis? Because I talked to my friend who is a pediatrician, and she was very much like, yeah, it's real. People come in all the time thinking their kids have been sexually assaulted, thinking this, and it really is just, but you can't just be like, oh, that's soap vulvitis. No, you got to look at all the other reasons. Like, has that person, had any issues? Has that person used this? Has that person had this? And then the way to tell whether it's soap vulvitis, you stop using the crazy soap you're using. And then when the symptoms go away, boom, bam, that's what it was. So, but you can't just look at it and be like, oh, she ain't got no problem. She ain't got no infection. She ain't had no trauma to the area. That's soap vulvitis. No, you let the pediatrician determine that. Okay. All right. Now, so yeah. A couple of other things. You want to make sure that, little mama is wearing breathable underwear. Now, I don't know what they got for these kids now. I don't have them, but in our, what was Fruit of the Looms, the little underoos, the little cotton ones, because I mean, they should have the little regular old, the draws. Like, that's what we call them, draws. You wear your draws. Like the big cotton ones with the little clowns on them, or the little hearts or rainbows on them. I don't know what they got in this day and age, but they was cotton, thick as a mug. They was just, I mean, So just those breathable underwear with a cotton crotch. Y'all want to be fancy with these kids. I don't know. They might even have like Victoria's Secret panties for kids these days. I don't really know. But make sure that it is a cotton crotch. Okay? All right. So yeah, that is the breakdown. Also, a couple of things that you don't want to do to help prevent infection with these children. Again, you want to start teaching the kids to wipe from front to back. Front to back. Just start them with that. Front to back. All right. Also, like I said, cotton panties. Another thing, please do not use fabric softener on your panties or the baby's panties. Please, not on Niecy's panties, not on her panties. No fabric softener. We're not doing that. Okay. Also, another big thing too that I think a lot of parents don't think about is hydration. Hydrate. Please make these babies drink water, because they're not drinking any water. You might give them some milk if you're a good parent, because you're worried about the calcium, but all this juice and this and that and the 5th, 7th, 3rd, and these kids is fancy, honey. They just going to Starbucks. They got the app on the phone. The kids, the 9-year-olds are at Starbucks flipping the phone like, I don't know, but at the end of the day, you want to make sure these kids are hydrating, because if they're not hydrated, they're dehydrated. They're drinking a bunch of stuff that's not water. Their urine is going to be concentrated. And obviously, we know half of them don't wipe the way they need to wipe, baby. And then here come the skin burns. And then here you go at the pediatrician office yelling at them people because you scared, or you don't know what's going on. You think somebody did something to your baby. So can you please give them children some water? Okay, if you give them a cup of juice for breakfast, can you be like, drink some water before or after for dinner? Can we have water for dinner? Even as a family, can we have water for dinner? Because you need the water too, sis. Period. Okay. Now, also, as far as once that little mama starts her period, she needs to bathe the same way as an adult woman did. And again, that was in a previous video. We can go back for that. Now, another thing, and again, all that bubble bath and all, no. Shut that down. That's an immediate no for me. It's an immediate, complete, and utter no for me. Like, don't even do it. Don't even ask me, can I? No, you can't. No, I'm sorry. I'm going to be very narrow-minded. I'm going to be very, yeah. You can't. Also, another thing that I really, really, really want my peri and postmenopausal women to be mindful of too is that, odors start to change. There are 2 different types of sweats. We have apocrine and apocrine. acrin and apocrine. Child, anyway, the point is that we have a smelly sweat and a non-smelly sweat, and as we start to get into that perimenopause or menopausal, we start to experience the smelly sweat way more often. At the end of the day, we start to want to get into more deodorant-y, perfumey, stronger types of cleansers, and I'm going to implore you not continue to cleanse the same way. The only thing that I would say is hydrate better. Hydrate better. Hydration is going to be a big thing. I mean, if you feel like, okay, I need to change my deodorant to clinical strength deodorant, girl, do that. Do that. I am not a fan of these body deodorants. What is happening? What is my skin absorbing? Why do I need, and it's like for your feet and for your, wait a damn minute. Why all of a sudden, like, if you have funky feet, wash them, bathe. And if you like, that's not helping, that's what a podiatrist is for. Do you have athlete's feet? Like, what is happening? Like, if we're bathing with regular soap and it's not helping, is something coming out of our pores? Do we have a medical problem? But this body deodorant, to me, it's like all this stuff is popping up. Why y'all scared to get in the shower? Like, and when you get in the shower, do you let the water hit you? Because I don't know, who was I watching one time and it's like, oh, when you get in the shower, do you wash below your knees? You right there. Like, it's not like you got to make an extra trip. It's not as if your knees are across the bathroom and you got to get out the nice warm shower to go across the cold bathroom to wash below your knees. Why would you not do that? So if you're not washing below your knees, you're not washing your feet. And then you get to these people pedicure place and got them in there sweating and scrounging, trying to scrape all that. And it ain't nothing but dirt and dead skin because you don't wash your feet. Don't get me started on that. I'm all like, y'all see, I'm kind of getting upset. I got to bring it down. I got to bring it down. But anyway, I hope this video helps somebody. Again, if you like, okay, well, what we supposed to do as adults? Go check out Monday's video. Run Monday's video through, okay? But I hope this helps somebody, especially my girl dads. And also, you know, just being a male in general and trying to understand the hygiene of women. And again, you know, I'll be telling y'all, look for red flags. So, you know, like I said, you know, this your boo and she constantly standing up to take a whole bath. It might be time to have a little conversation with sis, like, hey, listen, hi, do you want to get in the shower together? Let's get in the shower together. There's plenty of room inside. Like, you might want to start having a conversation. But this is for the fellas too, so y'all can start paying attention and knowing the clean girls from the unclean girls, okay? And, you know, use with that and do with that what you will. But anyway, this is Dr. Tasha. I hope this blessed somebody. I hope you learned something. And if you have any questions, comments, or any of the above, drop them down below. Y'all know I be in the comments. Don't say nothing crazy because I'll be having to pull back and pray about it, you know, but drop a comment down below. And I would love to engage with you guys. If you're not a member yet, just go on to the main page, like the visit my channel page, and hit join, because we do a whole bunch of stuff for the members, and we just gave a huge prize to our premium members. And yes, we love to have you over here. We love it. The vibes are the vibes. So anyways, I'm gonna get out of here, and thank you so much for joining. And again, I hope this blessed somebody. Bye, y'all.